Chapter 5. Pain Management Strategies. Living with a connective tissue disorder often means navigating a labyrinth of chronic pain. It's a relentless companion that can overshadow every aspect of your life. Yet the journey to effective pain management is fraught with challenges, not just from the condition itself, but also from societal and medical systems that misunderstand or stigmatize chronic pain patients. In this chapter, we'll explore a comprehensive approach to pain management that acknowledges these complexities. We'll dive into the physical and emotional facets of pain, discuss the challenges posed by current medical practices and policies, and offer strategies to advocate for yourself in a system that often falls short. Understanding pain, more than a symptom. Pain isn't merely a symptom to be silenced, it's a signal that something is wrong. In hEDS, pain can stem from joint instability, muscle overcompensation, nerve compression, and more. Chronic pain also has a profound impact on the nervous system, potentially leading to heightened sensitivity and a vicious cycle of discomfort. The nervous system's role. Central sensitization. Chronic pain can cause the nervous system to become hypersensitive, amplifying pain signals. Emotional impact. Persistent pain affects mood, cognitive function, and overall quality of life. Healing inhibition. High pain levels can hinder the body's natural healing processes. Personal reflection. In my experience, the best way to address pain is to fix the underlying problem. However, for many of us with hypermobility, getting to the root of the issue is easier said than done. I spent years seeking a doctor who would acknowledge my symptoms, let alone offer effective treatment. This delay not only prolonged my pain, but also allowed my condition to progress unchecked while I served for an entire second enlistment in the Marine Corps. The stigma of chronic pain, a barrier to care. The societal and medical stigmatization of chronic pain patients has deep roots, exacerbated by policies stemming from the so-called war on drugs. These policies, while aiming to curb substance abuse, have had unintended consequences for legitimate pain sufferers. The impact of the war on drugs. Restricted access to medications. Regulations have made it difficult for patients to obtain necessary pain relief. Physician reluctance. Fear of legal repercussions can make doctors hesitant to prescribe effective pain medications. Patient stigmatization. Chronic pain patients are often viewed with suspicion, affecting the quality of care they receive. Personal reflection. I felt the weight of this stigma firsthand. Despite debilitating pain from Ehlers-Danlos syndrome, I struggled to receive appropriate pain management. Instead, during my time in the Marines, I was overprescribed non-steroidal anti-inflammatory drugs, or NSAIDs. Things like high-dose ibuprofen, naproxen, and meloxicam. These medications helped me fulfill my duties, but at a significant cost. They led to chronic kidney disease due to prolonged use. The limitations and risks of NSAIDs. While NSAIDs are commonly used for pain relief, they are not without risks, especially when used long-term. Potential adverse effects. Gastrointestinal issues. Ulcers, bleeding, and stomach pain. Cardiovascular risks. Increased chance of heart attacks or stroke with prolonged use. Kidney damage. Chronic use can impair kidney function, leading to conditions like chronic kidney disease, as happened to me. Relying heavily on NSAIDs was a double-edged sword. They dulled the pain enough for me to continue my service, but ultimately contributed to serious health issues. This experience highlighted the necessity of balanced pain management strategies that consider long-term consequences. Finding the right specialist, a turning point. Finding a reputable specialist was a turning point in my journey. My provider not only provided medication, as I've worked with Dr. Erickson in Seattle, my pain management specialist has supported a balanced approach to pain management that improved my quality of life. Steps towards effective pain management. Initial consultation. My specialist took the time to understand the complexities of my condition and my experiences surrounding pain management. He was very caring and worked with me through a lot of my own hang-up. As a team, we address specific issues through surgeries that stabilize joints and release trapped nerves, physical therapy that helped me grow stronger, personal reflection. Soon after my diagnosis, I met my local provider to get my pain under control. Our first focus was ensuring that I was able to get good rest. Sleep has always been a challenge for me, but managing the nighttime pain allows me to string together more uninterrupted sleep. And it's also allowed me to stop some of the mental anguish and suffering with pain when it comes to be too much. Next, we worked on managing my daytime pain so I could participate in physical therapy and begin rebuilding strength for the next surgeries I would undergo. This proactive approach made a significant difference in my recovery and overall well-being. Finally, we were able to use medication as a gauge for when I was ready for the next surgery. By participating in a progressive workout plan and reducing my medication intake as I healed, we determined when I was healthy enough to go under the knife again for all 6 of my limb repair surgeries. This method ensured that my body was prepared and it optimized the outcomes of each procedure. Balancing discomfort tolerance and quality of life. While building discomfort tolerance can be a valuable skill, it's essential not to minimize or dismiss genuine suffering. Pain is a personal experience, and each individual's threshold and coping capacity are different. Strategies for balancing. Mindfulness and acceptance. Techniques that help you acknowledge pain without being overwhelmed by it. Physical rehab. Gradual exercises to strengthen the body can reduce pain over time. Psychological support. Therapy can provide tools to cope with the emotional burden of chronic pain. The danger of gaslighting yourself. Acknowledging reality. Denying or downplaying your pain can lead to further harm. Self-compassion. Treat yourself with the same understanding you would offer for a friend in your situation. Avoiding burnout. Pushing through pain without rest can exacerbate symptoms and hinder healing. For instance, following my first hand surgery, I decided to avoid narcotics for my second. I was determined to manage the pain with only meditation and positivity. While I made it through the experience, it was incredibly challenging. And since then, I've opted for traditional pain management for each surgery after. This decision wasn't about giving in. It was about acknowledging my pain and choosing a path that allowed for better healing and quality of life. There was a time when I tried to convince myself that the pain wasn't that bad, believing that mental toughness would see me through. This self-gaslighting only delayed necessary treatment and worsened my condition. Accepting my pain as valid was a crucial step towards healing. The importance of addressing root causes. Symptom management is essential, but whenever possible, treating the underlying issue should be the priority. Surgical interventions. Joint repairs. Surgical procedures to stabilize joints and prevent dislocations. Nerve decompressions. Relieving pressure on nerves to reduce neuropathic pain. Soft tissue repairs. Addressing ligament and tendon damage. Access to specialists. Challenges. Finding knowledgeable professionals can be difficult because hypermobility has been neglected by the medical community. But persistence pays off. Don't be discouraged by initial setbacks. Keep searching for the right provider. Telemedicine options. Remote consultations may broaden your access to specialists. Personal reflection. Undergoing 6 limb repair surgeries was daunting, but each addressed a specific issue contributing to my pain. By actively participating in physical therapy and preparing my body for each procedure, I improved my outcomes significantly. While surgery isn't the answer for everyone, exploring all avenues for treating root causes is vital. Advocating for comprehensive pain management. Effective pain management should be multifaceted, addressing both the physical and emotional components of pain while prioritizing patient well-being over regulatory fears. The role of opioids and restricted medications. Appropriate use. Opioids and other controlled substances can be vital for managing severe pain when used responsibly. Patient assessment. Doctors should evaluate individual needs rather than adhere to blanket policies. Monitor and safety. Regular follow-ups and open communication can mitigate risks associated with these medications. Overcoming barriers. Open dialogue with healthcare providers. Express your pain levels honestly and discuss all available options. Educate yourself. Understand your rights as a patient. Seek out the specialists. Pain management specialists may offer more nuanced approaches and advocate on your behalf. Personal reflection. We were able to use medication as a tool, not just for pain relief, but also as an indicator of my readiness for further surgery. By following a progressive workout plan and reducing my medication intake as I healed, we gauged when I was physically prepared for the next procedure. This approach ensured that I wasn't relying on medications longer than necessary and that my body was in optimal condition for surgery. Reframing pain perception. Understanding pain as a multifaceted experience can empower you to manage it more effectively. Pain is communication. Body's alarm system. Pain signals that something needs attention. Feedback mechanism. Helps identify activities or behaviors that may be harmful. Shifting the narrative. From victim to participant. Engage actively in your pain management plan. Empowerment through knowledge. The more you understand your condition, the better you can advocate for yourself. Personal reflection. Reframing how I viewed my pain, from a sign of weakness to a messenger, changed my approach to management. It became less about battling pain and more about listening to my body and responding appropriately. Conclusion. Effective pain management in hypermobile EDS requires a nuanced, patient-centered approach that goes beyond symptom suppression. It involves addressing root causes, advocating for appropriate treatments, including the responsible use of medications, and integrating holistic strategies to support the body's healing processes. As we explored in Chapter 4, the military mantra, pain is weakness leaving the body, was a guiding principle for pushing through adversity. However, through my journey and everything I've learned in Chapter 5, I've come to realize that this phrase can be transformed into something even more powerful and relevant to our experiences. Pain signals that healing is needed, and by embracing healing, we allow weakness to leave our bodies. Therefore, I now believe that healing is weakness leaving the body. This new understanding reframes pain not as an obstacle to be conquered by sheer force, but as an invitation to heal, to listen to our bodies, and to grow stronger through that process. Key takeaways. Acknowledge and validate your pain. Your experience is real and deserves proper attention. Balance discomfort, tolerance, and quality of life. Recognize the importance of managing pain to improve overall well-being. Advocate for comprehensive care. Seek professionals who will address both symptoms and underlying causes. Understand medication options. Be informed about the benefits and risks of all medications, including opioids and NSAIDs. Challenge stigmatization. Educate others and stand against policies that hinder access to necessary treatments. Integrate holistic strategies. Complement medical treatments with physical therapies, mind-body techniques, and lifestyle adjustments. Reframe your relationship with pain. View pain as a communication tool rather than an adversary. Healing is weakness leaving the body. By embracing healing, we transform pain into a pathway towards strength and resilience. The shift in perspective empowers us to take control of our health journey, fostering a deeper connection with our bodies and minds. Your journey with pain is deeply personal, but you are not alone. By combining self-advocacy with a comprehensive management plan, you can improve your quality of life and move towards a future where your pain does not define you. In the next chapter, we'll explore navigating school, work, and physical challenges, providing strategies to advocate for yourself and thrive in various environments.